All right. Welcome to the webinar. This webinar is hosted by the Gavi Civil Society constituency in partnership with Resorts UK, Save the Children, USAID Momentum Country, and Global Leadership, the Geneva Learning Foundation, UNICEF, and Gavi, the Vaccine Alliance. My name is Rosemary Mboro. I'm the Executive Director for Waki Health. We are an Africa regional advocacy organization. I'm based in Nairobi. I'm coming to you from Nairobi, Kenya. I will be your moderator, and I'm excited to take us through this very important webinar. The topic of discussion today is on immunization financing and accountability, looking at how we can secure funding for immunization and primary health care in the context of the COVID-19 pandemic. And I think it's important to mention that this webinar is one in a series of webinars. This is webinar 3. There has been other 2 webinars within this context, looking at immunization amidst COVID-19. And the first one, this being the third one, looking at health financing, looking at prioritization of immunization resources, and as well as accountability. And it's a very important webinar, as you all know, given where we are coming from, given the context that we are operating in with COVID-19, the disruption of health services, the diversion of resources, with missed vaccinations of many children around the world. And I think it's very important, that we discuss and look at how can we earmark, how can we secure national budgets for immunization, donor commitments, but also as civil society, how we can ensure accountability from our end and utilize the key moments and opportunities for that. I'm also excited to be moderating this session because we partner as Waki Health, we partner with Gavi and a number of other global health initiatives, including the Global Fund, UHC 2030, PMNCH, the Global Financing Facility, on a program we call Joint Learning Agenda. And it's a program that looks at strengthening civil society's capacity for health financing for UHC. That includes looking at even routine immunization financing, looking at how we link that to primary health care. And it's really great to see the leadership of Gavi, for example, supporting even with finances and technical support for that kind of program, which currently is running across 20 African countries, where Waki Health is the civil society lead for the Anglophone Africa countries, and we have our counterparts in Francophone Africa. I'm sorry, I believe my internet dropped. Thiago, you can hear me? Am I back?
Yes, you're back. Yeah, we lost you for a moment, but I think you can carry on right now. Thank you.
Yeah, so I think that's part of our day-to-day experience. But very happy now to introduce the lineup of speakers we have. We are excited. We have invited a panel of immunization experts, government and civil society organization representatives to discuss financing strategies to restore and maintain routine immunization. We have Dr. Ulla Griffiths. She is a senior advisor, immunization and health system strengthening at UNICEF. She is a health economist with expertise in economic evaluation of healthcare technologies, particularly in low-income settings. Very welcome, Dr. Ulla. Excited to have you on the panel. We also have Dr. Oneka Scott, Director of Maternal and Child Health, Ministry of Health in Guyana. She will bring us the expertise from her government in securing financing for immunization during the COVID-19 pandemic. She's joining us from Guyana very early in the morning, or maybe about 8 a.m. there. Very welcome to the panel. Happy to have you. We have Dr. Patu Musumari, Country Director Advisor of Village Reach, DRC. who will share his experience from a civil society organization in advocacy for immunization financing. Dr. Patu, very excited to have you on the panel. Welcome. We also have Dr. Mohamed Tafik Marshall. He is a team leader for WHO Sudan country, who has many years of experience in immunization progress across different countries. Very happy to have you, Dr. Marshall, on the call. We have Dr. Jo Andreas Ateke, Deputy Director for EPI in Cameroon, who will be able to speak about the challenges and opportunities that EPI programs are facing during the COVID-19 pandemic. Very warm welcome to you, Dr. Ateke. Then in terms of what you can expect on this call, in this webinar, in terms of the run of show, we will have our panelists share with us, depending on the questions that I will pose to them. They will have 8 minutes to reflect with us, to share with us, to discuss the key ideas, priorities, and experiences from their end. And we will start with Dr. Ula, followed by Dr. Oneka, looking at country level experiences in Guyana. Then Dr. Patu, bringing us civil society experiences. Then Dr. Tafik Marshall, bringing us his experience on immunization financing and transition process in Sudan. And then we will have Dr. Ateke, who will be speaking on immunization financing space in Cameroon. A warm welcome to you all, my dear panelists. To our participants, we welcome you to participate, to engage, to be curious, to write questions on the chat. And as our panelists continue to interact, we will also be considerate of your questions and comments. Without further ado, then, I want to welcome you, Dr. Ula, to share with us your reflections. My question to you: how do we restore and maintain routine immunization funding space as well as resources? Over to you.
Thank you very much. And I believe I have some slides coming up. I'm just going to give some context to where we are and also talk a bit about how much funding we think we need and where I think the space is at the moment. As some of you know, because of the pandemic, it's been hard to actually collect some data, etc. So that's also what we're struggling with, to actually knowing what the situation is. Next slide, please. Next slide. Okay, so I just want to give you a benchmark value about how much it costs to vaccinate a child. So here you can see for the first year of life, this was in 2020, I'm going to update this, but just to buy the vaccines for a routine schedule is $24, almost $25 for the first year of life. If you want to add MR and DTP boosters, which we should, then it's $26. Then the delivery cost is approximately $32. So when I say delivery cost, this is because immunization is part of the primary healthcare system. So this is what it costs with the staff, with the building, with the electricity. So the studies we've built this on, the average, it includes all these costs. So on average, around $58 we need per child to get the full schedule in. So just try and bear that in mind, and also bear in mind that we think it costs around, in delivery cost, around $190, $187, just to deliver one dose. So try and remember those numbers as benchmarks. It's just an average. Next slide. So first of all, immunization is what we call a public good. It's really expected that funding should come from the government. This is because it brings externalities. Nobody believes that mothers and fathers should pay user fees for this. So it should really be included in the government budget. However, as we know, Gavi is a main donor, and in more countries, but in the 57 countries, poorest LMICs, Gavi is funding the vaccines and also operational costs. And countries transition out depending on GNI per capita. So other financing sources we have, such as user fees, private sector, what people call innovative financing, which is very unspecific, is really very limited. We are really thinking about government and donors, that's the main thing. And in my opinion, that's what we need to focus on. We don't need to do anything fancy here. Just let's get the basics right. Next slide. So before the pandemic, we did a review of what government actually have in their budgets for immunization. This is not a fun exercise to look at all these budgets. It's not, they're differently structured in all countries, etc. What we found in 33 African countries was that on average in the budget, it was $625 per child in a birth cohort. So if you remember what I said, that we need just to buy the vaccines, it was around $30-something. You see, it isn't enough. They really don't seem to budget enough, but that's because Gavi is also pitching in, which is not in the budget. But it varied from 137 in DRC to 1766 in Angola. So if you take the proportion of the total government health budget, it was on average 2% of the health budget, which we would expect. As you know, health is much more than immunization. It probably shouldn't have a bigger proportion than that. It's very hard to get hold of expenditure reports. So a budget is one thing, but then does the government actually execute this? And we only managed to get hold of on 5 expenditure reports, and in 8 countries. And in 4 of these, budget execution seemed to be less than 50%. So it didn't look great, and this was before the pandemic. Next slide. So with COVID-19 vaccines, a lot of donors have given funding for delivering the vaccine. This slide I'm showing here is not about what it costs to buy the vaccines, it's really just the delivery. And so we have, at the moment, we are tracking this at UNICEF in something we call COVID-19 vaccine financial monitoring. And we, at the moment in this database, we have recorded that $2.88 billion has been given by the donors you can see listed here for COVID-19 vaccine delivery. We all know the reasons for this. The whole world is behind that everybody needs to reach 70%. So this is what all this funding has been given for. Next slide. So to show you what regions, these are UNICEF regions that this money has been given to, is on the left-hand side. So most of it is for Eastern Southern African region, 749 million. And then on the right-hand side, you will see what it comprised of. So a lot of this money is from multilateral development banks. So 52% is from loans and grants from the banks. Next slide. So here, if you want to think back to that first slide I showed you, where it was 1.57, I think, per child to deliver 1 dose, here you can see in per capita. So you can see we're actually talking about a lot of money that's been given by donors to deliver COVID-19 vaccine. So for instance, you can see in CAR, Central African Republic, is $3 per capita. So this is a lot of money when we looked at what it costs to deliver the childhood vaccines. So it's just a big contrast that what was given before to what we have now for COVID-19 vaccine delivery. Next slide. I think this is, yeah, so this is my last slide. So government expenditures for immunization was inadequate even before the pandemic. When we compared to what we know it cost and what we could find that they have in their budgets, it didn't align very well. Gavi is the most important donor for childhood immunization, but many more donors have come up now for COVID-19 vaccine delivery, and perhaps we can leverage on that and take this opportunity. So a substantial proportion of the funds that I showed you that's been given for COVID-19 vaccine have not yet been spent, and this is partly because vaccines were not available for many of these countries until 3 months ago. So, you know, they couldn't deliver the vaccines earlier. So we really need to try and strengthen the health system as part of reaching our COVID-19 vaccine coverage target when this funding is available. So to know how much funds for COVID-19 vaccines have crowded out routine immunization, we need to look at this systematically with these budgets that I talked about before. We are currently doing this at UNICEF in 3 countries, really to see, okay, how much did the government budget before the pandemic for immunization and how much now? Because we need some data to try and make these conclusions. So we all think that that funding have decreased, and we know fiscal space have decreased, but of course we need to look at it in more detail. Thank you.
Thank you. Thank you very much for those key highlights. Obviously, bringing to forward big financing gaps, and also in terms of execution of those budgets. There are some questions for you, Dr. Ula, on the chat. I would recommend that for the questions that need clarity, perhaps you can type away in the chat as we move to the next speaker. Allow me to bring Dr. Oneka Scott. Dr. Scott, could you please speak to your views and experiences from Guyana on restoring the immunization funding space, and a little about the key actors involved in the immunization financing space in your country? Over to you, Dr. Scott. You're on mute. You're still on mute.
Thank you for that, Rosemary. Good morning again. I believe I do have a presentation. If you could just have that up, please. Great. So before I go, if we could move to the next slide. Before I start on what are some of the local factors that influence sustainable immunization funding, and I really want to talk about sustainable here, since when we speak about immunization financing, we have to think about it as a recurrent cost. It is not an investment that we can invest in on a one-time platform. It must be sustained if we're to give the doses needed to get to where we want to in terms of our health system and herd immunity. So if you could go to the next slide, what we've identified. Right, what we've identified are some of the key factors in improving the immunization funding space. And so if we look at them collectively, strategic immunization development goals must topple that pyramid of factors as it indicates what are the other considerations that should be given to improving funding being sustainable for immunization. And then we have to speak about economic transformation, of course, both on a global and local scale. For global partners, we've seen that some of the partners mentioned before, Gavi, UNICEF, PAHO, the Rockefeller Foundation, they have led the charge for international funding. And although the current state of the geopolitical situation in the world, that being the pandemic combined with the current war, has somewhat decreased that funding or access to it, it's important to consider all these factors when we look at how we will develop our strategic immunization goals. We cannot just think that there are geopolitical factors affecting funding and not actually have those thoughts translated in planning in our local setting. It has to be part of our budgeting for health. We have to write it on paper to say, well, this is what we're dealing with in the world. And as a result, these are, again, some of the backdrops that we will have to improve our funding sources, whether it be in a local context. And then, of course, to talk about equity and inclusion is very important if we're going to talk about what type of funding that we will need. It's different to target everybody to reduce zero dose, and when you, as opposed to targeting a subset of the population, which in effect does not get you to herd immunity. Most importantly, we have to be able to leverage risk. In examining some of those barriers to vaccine funding, we have to consider that some of the systemic inequities that caused the pandemic in the first place to be so disproportionately affecting disadvantaged communities and populations are some of the barriers that we have still not been able to address. Some of those barriers, they've always been present, but what the pandemic did was to some of those barriers, and some of those barriers we want to talk about access to transportation services, cold chain infrastructure, human resources needs as very minuscule as they are. They do affect funding and how funding is utilized when it is received by the country. We have to speak about investing in the economic transformation as part of economic recovery after the pandemic. How is it that governments want to transform? Political cooperation is important. If you could move to the next slide, the penultimate slide. Local government spending in Guyana has always been without hesitation. We have invested without a doubt in ensuring that there is no child left. But most importantly, it has to focus on all the other factors that we just talked about, including the what locks it in is the public-private partnership. I believe that we are. Can I be heard? Rosemary.
We can hear you, Dr. Scott.
Right. I believe that we are at a critical phase since we have explored some of the wide ambit of local government spending, but we have not really explored the context of local private-public partnership. There is a strong view that the route of public-private partnership is one that is very much hidden, but it's definitely very effective. And in that way, it helps to preserve vaccine funding as a priority on the political agenda. Of course, private institutions will have risks that they need to leverage. And what the government of Guyana has done is taken up some of that leverage. And I say this because international public-private partnership has definitely been phenomenal. You know, it has impacted the current pandemic in a way that is really admirable. It has brought together big names like the Rockefeller Foundation, even FedEx and UPS in the delivery and transport of vaccines. This can be done in local settings, but although it has been traditionally shared in terms of the cost of purchasing and administering vaccine, it is my view that the public-private contribution may be further utilized in our local settings. So for routine child health vaccines, you may find minors or shop owners or private businesses who may want to offer even volunteers to help with data collection, who may want to offer funding in terms of transportation to get to the very remote areas. And these are things that we have to, in light of the pandemic, capitalize on to build a stronger immunization program. The good news is that we have seen in times of crisis that people come together from all ends. The pandemic has taught us that. So when we do have our immunization planning, we need to plan with crisis mitigation in mind. And one of the things that can make that possible is when we focus on targeting the right private partners to come on board. And of course, strengthening stakeholder ties like other ministries in Guyana. Lastly, I want to talk about one of the areas that may be very controversial in terms of international funding and accountability. For lower middle income countries and for emerging economies, it is my very strong view that we should not focus on loans. If we think about vaccine equity and we talk about the fact that if there are populations in developing economies that have not had access to vaccines, we cannot speak about vaccine nationalization. We have to speak about vaccine internationalization. And by that I mean, we have to talk about grants, not loans. We have to say we will be able to collaborate on an international level to give you funding, of course, checking all the boxes for the funding parameters, for you to execute your vaccine activities, for you to execute research activities, for you to ensure that every child, every adolescent, every adult has access. If we don't talk about grants as it relates to lower middle income countries, then we are not going to see an end to vaccine inequality globally, that is. And those are some pointers for consideration. Of course, we're open to country-specific questions on how Guyana has done it, but to wrap it up, multi-stakeholder interest has to be factored in planning and budgeting for health and the immunization program. We saw that during the pandemic, and we have learned that we cannot move forward without checking those boxes, bringing everybody to the same table and have that shared interest. And if we move on to the last slide, I say thank you on that.
Thank you. Thank you very much, Dr. Scott, sharing with us really critical perspectives from the countryside, from Guyana. And I think just three key things that stood out for me here is, talking about how as countries, most countries have explored the local government funding, but perhaps not tapped sufficiently into the public-private sector and what that could do. Then you are talking about immunization planning and how we need to think about to do that with crisis mitigation in mind and prepare adequately for that and finance adequately for that. And to your last point about the debt situation in low and middle income crisis as countries, I think introduces for us a very critical reality about the way most of the low and middle income countries are having to struggle with the debt crisis, and still plan on scaling up investments. And so I think that is very well taken, and it's a reality that we are facing. To all our participants who joined us after we had started, a warm welcome. We are now on panelist number 3. We have already had inputs from a health financing expert, Dr. Ula, highlighting for us key financing gaps, but also bringing very important points around budget execution and many other great insights. We've heard from the country level, Dr. Scott from Guyana, with really great remarks. Allow me to turn to a civil society perspective. I will invite Dr. Patu Masika. Could you please share a little about your work with local governments to help protect and advocate for increasing immunization financing? Over to you, Dr. Masika.
Thank you, Rose. My name is Dr. Patu Musumari Masika. I'm working for Village Reach DRC as the advisor to the country director. I'm talking to you today from Village Reach office in Kinshasa. So before I start my presentation, I would like to quickly acknowledge the work of my colleagues, Carla Toko and Benedict Wahula, on behalf of whom I'm talking today, and who are doing extraordinary work pushing forward the advocacy for immunization financing in DRC. I think I'm still waiting for my slides to appear on the screen. Thank you. So next slide, please. So this is the outline of my presentation. I will start by giving you a quickly context of the immunization financing in DRC. Then I will elaborate on Village Reach roles and key achievement, and finally present some challenges, opportunities, and perspectives. Next slide, please. Next slide, please. So when talking about immunization financing in DRC, I think it is important to outline some of the milestones that have enable the dialogue around this topic. And here I would like particularly to focus on the Declaration of Kinshasa in 2019, which was the outcome of the first National Forum on Immunization and Polio Eradication. So this forum, which was under the sponsorship of the DRC president, brought together the governors of all the 26 provinces of DRC, the presidents of provincial assemblies, as well as the provincial ministries of health. Next slide, please. So from that forum, three commitments emerged. Here, I'm going to focus only on the first commitment, which was about funding for immunization. So at the national level, those in authorities agreed to disperse all funding for the purchase of vaccines by the end of the first quarter of each year, and they also agreed to have a budget line dedicated for immunization activities. And at the provincial level, there was an agreement to enact edict legislation that will prioritize immunization funding, and also those authorities agreed to contribute the amount of $1 per every child as part of their immunization financing. Now, the big question is whether or not those commitments were fulfilled or respected. Next slide, please. So as you can see in this slide, in 2021, the central government of the DRC was able to fulfill its commitment, but this is in contrast with the performance of the provinces. So as you can see, all the provinces put together were only able to contribute 19% of the needed funds. And if you look at it, only 9 out of the 26 provinces contributed. Next slide, please. And when you take a look at this slide, you can see the majority of provinces, actually 18 out of 26, have edicts, have a legislation that ensure a budget line for immunization activities. But most of them did not contribute or did not contribute a significant amount of money as they're committed to, with, of course, some few exceptions. So it is in this context that Village Reach is working together with many other partners in order to improve the immunization financing landscape in the DRC. Next slide. So overall, Village Reach is working to strengthen advocacy activities for immunization financing, and we also advocate for the implementation of the DRC polio transition plan. So how do we do it? We engage with a wide range of stakeholders, including civil society organizations, parliamentarians, and media, and so many other immunization partners in order to raise their awareness on polio transition, and also to raise their awareness in the need to support disbursements of funds for immunization activities. Next slide. So for this particular portfolio, we are working in 3 provinces, Equateur, Kwilu, and Kinshasa. As you can see, Equateur and Kwilu have edict legislation that ensure a budget line for immunization activities, but both provinces haven't yet mobilized any funding in this regard. In Kinshasa, there is no edict, there is no legislation, and there is no funding for immunization activities from the local governments. Next slide. What are some of the key achievements we managed to obtain so far? As I mentioned before, in Equateur province, when we started our activities, there was an edict which was already enacted, but it was not published in their official journal. So what we did was to advocate for its publication, which is now already done. In Kinshasa, we are supporting the provincial parliamentarians in the drafting of the edicts that will ensure that the budget line is included for all the immunization activities. So the edict proposal will soon be introduced for the adoption by the provincial assembly. So we also do visits or briefings to local authorities to raise awareness on previous commitments, particularly the commitments that were made during the declaration of Kinshasa. So we sensitize them on the need for local funds in support of the immunization and polio eradication activities. So we are also in Kinshasa in the process of establishing what we call a REPACAV. And REPACAV is, this is in Kinshasa in Equateur. REPACAV is a network of parliamentaries that support vaccination. Next slide, please. This is just a selected photo gallery of some of the activities that we've been doing from left to right. And in the upper range, you can see our meetings with the national REPACAV. So this network of parliamentarians who supports vaccination activities and make sure that there is a budget line for vaccination around in the parliament. So there is a national network and there are also some provincial networks. So that was a meeting with the national REPACAV. The next one is the meeting with the presidents of the Provincial Assembly of Kinshasa. This was in prospect of preparing the assembly in terms of our plan to introduce the edict. So we went to meet the presidents of the assembly and raise awareness about this issue and sensitize him about the importance of having this edict passed, because that will ensure the budget line for vaccination. So the next picture is about the community outreach by Kinshasa provincial parliamentarians who are taking ownership of those activities, going down in the streets and meeting other people to sensitize on that. Next slide. There are many challenges when it comes to pushing forward this advocacy agenda. One of the challenges that I can pin here is that we've been having really hard time maintaining a regular contact with the REPACAV because politicians they're most of the time have a very busy schedule, and it has been a very it really has been very difficult for us to maintain this regular contact and to keep the momentum. Another challenge is as I mentioned before, most of the provinces, even those who have edicts, still do not disperse funding for immunization activities. So we're still pushing for that to happen. Next slide. And we also have some opportunities to make this agenda go forward. One of which is that we can we're trying to seize the momentum from the second National Forum on Immunization and Polio Eradication in 2021, and that kind of renewed the declaration of Kinshasa, the renewed commitment that local governments and national governments should continue to contribute for polio vaccination, immunization financing. Next slide. Some of the perspectives, we said that we will continue to pursue our advocacy to work to incite voting of edicts in the remaining of provinces. Actually, 8 provinces in the Congo still do not have legislation that ensure a budget line for immunization. We will continue to sensitize the community on the importance of routine immunization, and we will continue to engage more with civil society organization in all provinces by increasing awareness on previous engagement made by authorities, particularly in the declaration of Kinshasa, and for more follow-up. Next slide. I will conclude here by saying thank you very much for your attention.
Thank you very much for that perspective from civil society. Take a look at the chat. There are some questions regarding this experience that perhaps you could think about as we prepare to come to the open to all Q&A, Dr. Masika. Allow me to take us to Sudan by inviting Dr. Mashal to help us get an insight from his end. Could you please speak about the operationalization of the integrated public health team and trend in immunization financing during the transitioning process in Sudan? Over to you, Dr. Mashal.
Thank you so much, Rosemary, and my greetings to all panelists and our respectable attendees. Giving some perspective from Sudan, I hope you can show the slides. Yes, next slide, please. Actually, on a very brief on the context of Sudan in terms to finance the immunization, the country has been facing with several challenges. The most important challenge is economic rundown in the country and political transition. The political transition in the country started in April 2019 and further exaggerated by a coup in October 2021. The second challenge that we have is a double transition both by Global Polio Eradication Initiative as well as by the Gavi. I will give you some more detail on that in the coming slides. And the last, as we all know, the impact of COVID-19 on low-income countries, and particularly shifting the very scattered resource of Sudan toward management and response to the COVID-19, and then diverting that from the essential public health functions. So all of these actually giving us a very tough time in the country in order to support the immunization, both routine immunization or essential immunization and polio eradication from the financial point of view. This presentation will give you some innovative way that how we overcome part of the problem, but still we have to move ahead with more holistic approach of that. Next slide, please. Yes, through the accelerated transition phase defined by Gavi, it is expected that Sudan should significantly increase the co-financing starting from 2018 and ending to full transition by start of 2025. The implication of that is very huge financially for the country. We can see the country should increase their co-financing from 3 million in 2018 to 30 million in 2025, a tenfold increase in overall budget implication to the national government. Next slide, please. On the other hand, the Global Polio Eradication Initiative also has a sunset in their resource for most of the countries. We can see a trend of decreasing from 2019 onward for the coming years, even 2023 as well. It might have an implication of more than 200 million US dollar. The fact is that more than 80% of this budget is going to the two endemic polio country of Afghanistan and Pakistan, and there is very small room for non-endemic countries and polio outbreak countries such as Sudan. Next slide, please. This slide giving us an overview of budget implication and decline by the Global Polio Eradication Initiative for supporting of the polio program in Sudan from 2016 to current year. There is a huge decline from around $6.8 million in 2016, come down to 4 million starting from 2018, and further to only $1 million in year 2021 and 2022. Although the huge slash is on stopping of to support the supplementary immunization activities, but there is also implication on the EHP surveillance and human resource support as well at the country level. Next slide, please. So in order to find, at the beginning, even we realized that the capacity of the government to increase their financial support to immunization program is very limited, and there is not much hope for that. On the other hand, there is also less opportunity by in-country donor and partner as well regarding the other competing public health priorities, for example, public health emergency, very high burden of communicable disease in the country. Therefore, we at the immunization program start thinking about to find at least a solution for that. And therefore, we use the opportunity of polio transition and diverted that from the challenge to the opportunity in order to support part of the financial deficit of the program. We are currently actually bringing together 4 programs of polio, routine immunization, health emergency, and health system strengthening at the WHO country office in order to maximize the efficiency and also have a common ground for the key activities. And then in long term, we want to transfer the same mechanism to our counterparts in the national government. Next slide, please. A very quick overview of the polio transition. You might all know that actually 16 priority countries are considered for the polio transition based on the justification that 90% of the polio budget has been using by these countries globally. Most of the country for polio transition is laying in Africa. Next. In our region of Eastern Mediterranean, actually, initially, the global team defined 4 countries as a target for the polio transition, named Afghanistan, Pakistan, Sudan, and Somalia. Later on, regional steering committee added 3 more countries of Yemen, Syria, and Iraq as well. In total, now we have 7 countries for this activity. Next. Yes, all the polio transition countries actually started by developing our transition plan. And luckily in Sudan, we have developed the transition plan and finalized and endorsed it both by the country as well as by our regional steering committee. We did a very extensive exercise of asset mapping, finding the source of the funding, also distribution of the human resource, as well as inventory of the all asset at the country level. We also define a governance body for polio transition at the country level, and also assign a senior government staff at the Ministry of Health as a focal point for the polio transition. Sudan is the first country in the region implemented the integrated public health team training in March this year. Now we are in the phase of starting the polio transition plan at the country level. Next, please. This slide giving us a very quick overview of what we are actually talking about the polio transition and harmonization of activities among the programs of polio, health emergency, EPI, and health system strengthening. In summary, actually, we focused on the 2 key pillars. One is the outbreak preparedness and response, and the second is integrated public health surveillance. So for that, we actually define the area for each individual program. And then we also define the key monitoring indicators in order to track the progress on that one. So a core component of the polio transition in actually enhancing efficiency, not only in terms of activity, but also in terms of cost as well, will be a very well established integrated disease surveillance system. We are much optimistic to use the very well established network of the EFP surveillance in order to support the surveillance system for other WHO health, for example, activities such as the health emergency, EP, routine immunization, as well as the health system strengthening. Next, please.
Prime time. We are out of time. Maybe you could finalize.
Okay, very quick on the participation of the polio workforce. They actually supported not only polio program, but other programs as well. For example, the EPI, COVID-19, health emergency, and primary health care. Next, please. This slide giving us more details on that, how the polio network supported routine immunization in terms of measles, diphtheria, rotavirus, and others by their contribution in not only in time, but also finance as well. Next. Yes, this is more details on the rollout of the integrated public health functions. The map on the left side giving us the situation of individual program or vertical program, and then it's moved back on the map on the right side to more public health functions or public health officers. We develop a common QR for them, the reporting mechanism, also and the monitoring mechanism as a state public health officer. Next. Yes, the last slide, this is about the accountability that we deliver at all levels of state, the region and the WHO country office, with a clear role and responsibility and a line of reporting, both from bottom up and from top to down, engaging as a core component, the head of the WHO sub-office at the regional level. Next. Yeah, the challenge we all know, we still have to move ahead with the staffing of the WHO sub-offices and functionalize that one in the year 2022. And also the impact of the social and political economic situation in Sudan is another challenge. Next. And the way forward, we are looking forward in order to see review the country level finance as well as gap in the coming year to see through a detailed cost benefit analysis the impact of the financial contribution that we made through the polio transition activities. Thank you so much.
Thank you. Thank you so much for taking us through a very detailed presentation and allowing us to see how things are moving on in Sudan in terms of operationalizing the integrated public health team and the trend in immunization financing during the transition. Thank you very much for that. We will come to the last but not least presentation. Dr. Ateke, welcome very much. Allow me to ask you to kindly speak to the immunization financing space in Cameroon and some of the lessons learned. Over to you.
Thank you so much, Rosemary. It's a great pleasure for me, and I'm honored to be with you all, the panelists and the rest of the team. I'll be glad if the presentation could be projected, please. Thank you so much. So we are going to look into immunization financing and accountability in Cameroon within the current context. Slide, please. So we will respect this outline. Slide, please. So this is Cameroon, this beautiful country in West Africa. You can see the in brown. And this country has close to 28 million inhabitants this year. And also in this country, we have been experiencing insecurity in some parts of the country for over 5 years now. Routine immunization and supplementary immunization activities are being carried by EPI for several years now. And financing, the major financing partner, it's Gavi. With the COVID-19 outbreak, the country has experienced some challenging affecting financing of immunization activities, particularly routine and supplementary immunization activities. And partly we can see that the IMF observed a fall in the GDP from 4% in 2019 to 7% in 2020 due to COVID-19 pandemic. The government also put in place some measures to mitigate the effect of COVID-19, and these measures were also found to have a negative effect on income and financing of activities like vaccination in favor of COVID response. Slide, please. Notwithstanding, some measures have been put in place to help to improve. Firstly, one of the approach has been to integrate COVID-19 response vaccination with routine immunization. The same actors have been used, and this has given the opportunity to ensure continuity of routine immunization till date. Also, COVID-19 has been a great opportunity for capacity building of health actors, and these same actors continue routine immunization and supplementary activities of vaccination. In addition, there has been an improvement in logistics, particularly cold chain has been improved upon to meet all COVID-19 vaccines. And these services are also fully available for routine immunization. Financing has also, COVID-19 has also opened new doors, new partnership for immunization services, which are beneficiary to routine and supplementary immunization. Slide, please. It's also good to note that we also leverage other services, other primary healthcare services, like malaria response activities in the country. The malaria program has community health workers that benefit from some funding. So the EPI has integrated its activity with the minimum package of activities of these community health workers. So they give us the opportunity to be able to track missed and zero-dose infants during their intervention in the field without any additional cost for the EPI. And the EPI has also integrated the IPT for infants in the vaccination program in five schedules. This also opens us windows for future collaboration in the case malaria vaccination is introduced in the program. On the other hand, routine immunization and supplementary activities for vaccination also administer IPT and distribution of mosquito net that helps to support the malaria program. We also integrate nutrition activities, and the nutrition workers also help in tracking of missed infants. Slide, please. Talking about the official donor assistance and domestic funding, our major funder remains Gavi, and Gavi has been funding fully, especially new vaccines, and also partial funding for co-financed vaccines. It's good to note that Cameroon has been funding fully some traditional vaccines listed, and we also experienced an improvement from 15% in 2011 to 26% this year for vaccines that are co-financed by the state. So the state's contribution has experienced an improvement. Notwithstanding, there is a delay that has been observed in this transition because we were expecting a full transition by 2014, but we say we are still at 26%. To be able to control this measure, this challenge, an interministerial coordination team has been created to help mobilize resources and to ease generation of finances from the various stakeholders of the government. We also have an improving collaboration with local partners like the CBC Health Board that are currently supporting COVID-19 vaccination and routine immunization. There's also a strong collaboration with civil society organization represented by the association called Provarex, which groups over 32 civil society organizations. These have served as a great opportunity in current times to mobilize fundings to support vaccination activities. In addition, decentralization has also opened a window for us to have fundings for health activities, including immunization services through the local councils. Slide, please. Notwithstanding, it still remains very challenging. There is delay in the mobilization of funding. The state has been unable to rapidly mobilize resources to meet up with the contribution for vaccines. So our deadline for 2014 for 2024 transition remains challenging. There is also a delay in response to emergencies due to this delayance we observe in mobilization of resources, both from local and international donors. Notwithstanding, we strongly believe that by strengthening local collaboration, empowering local income generation, financing, and also strengthening official donor assistance, it might help to downplay the challenges we face in current time following COVID-19. So with this, I would say thank you so much for listening.
Thank you so much for that, including sharing lessons learned from your end, and also some of the challenges that are being experienced. Thank you so much for coming to us from Cameroon. I will now quickly turn to all the panelists. There has been quite an engagement in the chat with questions, with comments, and I want to, in a minute, invite all the panelists to come on. So then each of them could reflect on any of the questions that has been raised or any of the comments that has been raised. We believe the participants have posted their comments and their questions. A lot of that has already been responded to, but we did want an opportunity to provide any concluding remarks and to link that to any of the comments. Just to remind us that this is a webinar on immunization, financing, and accountability, looking at increasing and earmarking national immunization and primary healthcare funding, and also donor commitments, but also looking at civil society role in accountability. And a lot has been brought forward, including hearing about the health financing gaps for immunization, for primary healthcare, for the health sector, looking at other challenges that have been mentioned, including budget execution, but also delays in disbursement of funding, delays in fund mobilization. There have been a number of opportunities that have also been mentioned, like tapping into public-private partnerships, ensuring that we are having in mind crisis mitigation when we do our planning, but also bringing to mind the situation around debt crisis in most of the low and middle income countries, and having that shape our thinking when we do resource mobilization. And we've also, had a civil society perspective in terms of some of the ways we are engaging in media engagement, parliamentary engagement, raising awareness. And there's a lot already going on in terms of accountability for either national commitments or regional commitments. And there are so many other global commitments that we need to rally around. The example from Sudan, really comprehensive on transition and what is going on in there, setting up governance structure, common terms of reference, assessment to look at resources, assessment to look at human resources for health, and so on. And of course, last but not least, the lessons learned, from COVID-19, including integration of routine immunization, of COVID-19 vaccination in routine immunization, scaling up community health workers, ensuring that we are tapping into the skills that already exist, ensuring that we are cost sharing, and so many other fantastic insights that have come on. So I now want to invite our distinguished panel to take a moment to reflect on just their concluding remarks, referring to any of the questions. In the same order that we started, I invite you, Dr. Ula.
Thank you so much. No, I mean, thanks to all my fellow panelists, and my main kind of takeaway is I thought there was a really good coherence between our presentations. So we all, it comforts me, even though I sit in New York, very far away from where things are happening. I feel as if we all know that a lot of funds came in during COVID-19 vaccine, and we need to make that an opportunity, which is great. And it's also really nice for me to just start talking about routine immunization again, because in the past year, we've only talked about the COVID vaccine. So like, for instance, polio transition, getting that back on the agenda. So yeah, I just feel it's really nice that we are getting back to it. But we have so much work to do to get a handle on, just as I said in my presentation, get a handle on where are we with, like, what are governments committing, and how is this donor funding gonna continue? So yeah, thank you.
Many thanks, Dr. Scott. You're on mute. You're on mute.
Thank you, Rosemary. Can I be heard now? Thank you, Dr. Ula. Some very valid points and contributions made there. I think it's important to recognize that although the contextual situation per country or per continent may vary, the overarching goal is to ensure that we look at those factors that are geopolitically influenced and inclined. And we cannot at this time on planet Earth negate that. In budgeting for health and planning, we've got to take into consideration situations that we hear on the news all the time. I think the pandemic has taught us that to some extent, globally, we were not prepared. We were not prepared for all the costs incurred, the accelerator that was launched in April 2020 by WHO and its collaborative partners showed us that we do have to think about all the financial gaps that exist, and it does in lower income countries and emerging economies. We use somewhat about 6 to 4% of our GDP in preparation for the pandemic spending, while high income countries use 35 to 45%, but it was still not enough. So I think where we should be going globally and in local context and local settings is identifying those gaps that exist and theoretically and hypothetically planning. We have to embrace more practical solutions. This has to be everybody's business. We cannot continue sustaining funding without it being everybody's business. And I think that's where I want to wrap up.
Thank you for that. Dr. Masika, over to you.
Thank you, Rose. I think from my side, I would like to, as a conclusion, to address comment and a question from the participants. One asks what more Gavi can do to support DRC in its objectives, particularly in terms of the advocacy work. I think one way to go is to continue and help set up the network of parliamentarians who support vaccination in the remaining of provinces. We think that this is really important because those parliamentarians will act as safeguards to ensure that there is a budget line. Immunization financing remains a priority in the provincial assembly, but setting up those networks are not enough. We need to think of a way to capacitate them with knowledge that is important for them to really continue doing the advocacy work internally. So capacity building activities would be really important for those parliamentarians, as well as for many other civil society organizations that are all working towards pushing forward the immunization financing. Another comment was that many countries are progressing towards program budgeting rather than specific budgets for activities. I think I agree with that comment. But I think for local government, it's really important to make sure that those specific line budget, for example, for immunization, is always there. And at the central level, we can think in terms of a more broader program budget. But for local governments, we need to make sure that they're accountable and they take our responsibility in terms of financing specific budget lines. So that would be it for the comment that I received. And thank you very much.
Thank you so much for responding to that. Dr. Marshall, over to you.
Okay, thank you so much. Actually, three messages from this call. The first, the call was a great opportunity to know about the global perspective of immunization financing and also learn from the country-specific experience. So thank you so much for all the presenters and panelists on that one. It was a very informative and instructive. The second is that whenever we are talking about immunization financing, it's not all the time directly the cash flow and the money that we have. Sometimes we can also think about the efficiency of activities through harmonization, coordination, integration that will also save us the cost. So one of the examples we can pick up from the Sudan is that this integration also saving us some cost in overall context of the immunization financing. The third is that I think now it's time to rely more on in-country domestic resource mobilization and engaging some of the partners, which was at least less used by the countries, for example, the private sector and the community itself as well, in order to fill the gap of immunization financing. Thank you.
Many thanks for that. Dr. Ateke, over to you.
Thank you so much. One observation I realize is that COVID-19 has weakened the health system, but it has equally been an opportunity for us. It has helped us to begin strengthening even more our health system through training, strengthening of the cold chain for vaccine. And one great lesson I pulled from this session is the fact that with a clear budgetary line voted from the Parliament for vaccination services can really greatly help us be able to close our gaps while strengthening collaboration at local level to sustain vaccination services. Thank you so much.
Thank you so much for reflecting on that. We have come to the end of our conversation, our webinar. I want to thank all the speakers, our dear panelists, Dr. Ula, Dr. Scott, Dr. Musumari, Dr. Marshall, and Dr. Ateke. We thank you very, very much for your great insights, for participating as panelists. It's been really great listening to you, hearing from your expertise, your skills, and your experience. Thank you so much for sharing that with us this afternoon, morning, or evening, depending on where you are. Also, a warm thank you to all dear participants for joining us and engaging in the chat. We thank you very much for the constructive engagement that we've seen, very helpful. I want to thank the co-organizers, Gavi CSO Constituency, Results UK, UNICEF, Save the Children, Gavi, USAID, Momentum, and Geneva Learning Foundation. Thank you so much for putting this webinar, which has been a series of 3 webinars. And what will happen next is that the co-organizers will produce a policy brief out of these 3 conversations as takeaways, messages from all the 3 webinars. The policy brief will then be shared with us, with all the participants of all the 3 webinars. I thank you very much. Have a great day, Father.